Hi, thank you for your interest in volunteering at the Athens Regional Spay and Neuter Center. Just to go over a couple things with you guys about some of our rules, regulations, violations, and anticipations of our clinic. We are a high-volume, low-cost spay and neuter center. We attempt to do 25 to 30 surgeries a day, and because of that, you can only imagine the kind of work we have before us. We've got 1 to 2 veterinarians per day, as well as 1 technician and 1 assistant. Because of that, we're going to be going over instrument care, pack wrapping, general cleaning, as well as kennels, filling the mop buckets, folding drape, opening syringes, as well as masks and tubes. This is our surgery suite. This is where all the surgeries take place. Behind the glass wall here is our prep area. This is where all the animals are prepped. That's Jen, she's our veterinary assistant, doing a fine job over there with a little female cat. So, in the event of an emergency, you will hear and you will be told that there's an emergency going on. We will prefer that you exit our surgery suite and either wait in the hallway here, or this hallway also leads back to the lobby. And we'll wait there until further notification that it's okay to come back in. This will allow us to get what we need to get done for life-saving measures, as well as no distractions and room to run around and get what we need. We have so many surgeries here per day. We're trying to keep conversation to a minimum. If you have any questions about your personal pets, definitely let the technician or assistant know, and we will be happy to ask a veterinarian if time permits. In the surgery area, let's keep conversations to a minimum, no cell phone conversations or food and drink. Moving about the clinic, please be aware to stand clear of the anesthesia machines, the prep tables, the staff, as well as the surgery tables, the anesthesia machines for both of them, and the instrument stands. They're very important to maintain sterility for our surgical patients. So this is how we wash instruments here at the Spay Neuter Clinic. They are placed into this bucket full of solution with soap after surgery. So we kind of just jiggle them and get them out here. And then we will take them into the kitchen, which is over here. And make sure when you're walking behind the surgery area, always avoid the Mayo stands here, the surgeons, and the animals themselves. This is where we wash the instruments. What we do here is the instruments that we got out of the solution are placed into this blue bucket here. And we want to come closer, show you. This is the scrub brush that we use. We'll run it on water and watch out, this hot water gets really hot really quickly. All instruments that touch the animal are scrubbed, rinsed, and then placed into this. This is a sonicator. This will jiggle them and clean them 16 times better than hand washing alone. But we offer hand wash as well. You want to make sure you get the grooves, all the joints, to make sure that we had all organic tissues, if there are any, out. And then rinse and place them in the sonicator. For any instrument that has a joint on it, you want to make sure you leave it open when placing it in the sonicator, except for the scissors. Those can remain closed. And also the needle holders, which have gold handles. So needle holders and scissors are remain closed when they're put into the sonicator, but they are scrubbed with the ratchets open. After you finish that, and you want to make sure that all instruments that you remove from the solution are scrubbed at one time, you're going to place them in here, and you're going to set it at 10 minutes. And cover. Alright, and that's how you clean the instruments initially, and we'll go into drying and everything in a minute when they're done. When removing the instruments from the sonicator, you want to jiggle the solution off. They're in this handy basket here. We want to rinse the solution off. Also, we don't want to use that with tap water, but we'll use distilled water instead, which is kept in this bucket. Just place the basket into the bucket, and it is rinsed. When you lay it out, you want to lay your ratchets open. I try to separate the different sorts of instruments and group them together, since we'll have multiple packs drying on this area at one time. And so just put what looks like together. And just lay them out with all ratchets open so that they'll dry properly. After the pack instruments have had a chance to dry, we'll lubricate them with something called Spectra Lube. This is to increase the longevity of the instruments as well as improve joint function. What you do is you just take it and you want to spray a small amount right here on the joint, and then you'll close the instrument and place it into this bucket to go back to the pack wrapping area. And we'll do that for all the instruments. And just a dab will do. You don't want to soak it too much. And I try to keep all the similar instruments together again to ease in sorting them in the next step of the process. As we move to the pack wrapping area, which is here, we'll sort these instruments based on the labels that are on the containers, and we'll go over those real quick, what they are and what they do. A lot of times you'll have some that are already in there and just follow suit, but these are spay hooks, and they'll go in the first bucket. These are scissors. They have no gold on the handle and look like scissors. Needle holders do have gold on the handle. You'll notice that they have a scissor quality as well as little pads that help hold the needle during surgery. Hence the name needle holder. These are thumb forceps. They look like tweezers. Towel clamps have little O-rings on the ends, and those can be clipped together, two together at a time. Alright, and so we come to the Kellys. Kellys and hemostats, which are similar looking but differ in a couple ways, and I'll show you that. The first one, these are straight hemostats because they're straight, and then these are curved right here because they have a curve, but they're both called hemostats. These are called Kellys. This is a longer head than a hemostat. You'll see that, the difference there. And also the curved Kelly is similar to the straight, just it has a curve. So that's the big thing to remember with the Kellys. And you'll place those, the long Kellys will go together here, and then the straight ones will go in here and the curve will go there. And there should be some in there for you to follow suit later, but if you have any questions, there is a picture always available for what things are, and also pack contents of how to wrap packs, which we'll go over now.